It is me. Tomorrow is my surgery. It's actually St. Patrick's Day, I guess, my surgical day. I will be going in at 6:30 or 7:30 a.m. Eastern Standard Time. So if you could think good things of me during that time period, that would be great. Those of you who know me know that I don't really believe in God, because why would a God do something like this to me? Beyond the fact that I've never seen any evidence, I actually give complete credit to my surgeons and their work on earth in their hands, because I've never seen God's hands do anything. And I'm actually really grateful that people go and study this stuff so that they can do these amazing surgeries. My surgeon is excellent. I'll share his profile later, but he's amazing, and everyone here has been really, really nice. Hopefully tomorrow, when I do go in, I should be waking up sometime tomorrow or tomorrow evening. I think they wake you up just to make sure everything's okay, but you don't actually end up opening your eyes, I think, sometimes for a few days. You get really, really puffy. Now, I've asked my husband to actually take a photograph or small video just so you can kind of see like the difference between me now and what I will be looking like, just so you have like an accurate depiction for those of you who have not undergone this, because you get very swollen up because they fill you very full of fluid when you go through this. So I wanted to talk a little bit about attitude portending outcome. Obviously, if you followed me for a while, you know this is a lot that I've gone through in my life. This will actually be surgeries 10, 11, and 12 by the time it's done. 12 is one of my lucky numbers. It's a 3, so I actually feel pretty good about that. I know a lot of people are like, I would never be able to handle that. I don't think I could go through that, but I don't think that people really underestimate just human survival and just how we have it in us to do, and you never know until you actually get there. Now, if I was sitting here crying and really scared, I don't think that I would have quite as good or possibility of as good of an outcome, as opposed to now where I'm very mellow about it. I know what's going on. I have cried, but my blood pressure is not like 180 for 83, which is what it was for a few days, because I didn't know what was going on. But now that I know what's going on, I'm actually much calmer. They've been getting really reasonable blood pressure readings for me. I'm still in a lot of pain, but I'm trying not to take too many painkillers. I've never been the type of person that wants to be addicted to any kind of opioids, and I'm pretty resistant to it. So one thing that you have to do, or one thing that I highly recommend you do, is obviously in this situation, it's planned. It's not like an emergency. Planned is always better than an emergency because obviously you have more control. Obviously, I've been here for days. They've been monitoring me. They've given me the test. They know that this is something that I've done before. They feel very comfortable. Again, the surgeon said he was very confident that he was very optimistic that things were going to go well, and that's all I can believe. So I have to actually calm myself down. Again, I don't expect that it's not like I'm not going to cry, but at the same time, all I can do is picture the most positive outcome that I can have, and that's actually, again, going to attitude portends outcome. It's going to lead me into a better place than it would be had I been sitting here freaking out and crying and worried and worried and worried. This does not mean that something bad might not happen tomorrow. Obviously, it could. None of us knows everything. These surgeons do their best. I'm doing my best, and, I'm doing everything that I could possibly do. And this is something that, you really, for those of us who have been through this is actually going to be surgery, again, 10, 11, 12. So it's a lot of surgical intervention, but I'm pretty good at it. And again, I'm making all the nurses laugh. A few of them have come by even past their shifts. A few of them have mentioned that they're going to come try to see me afterwards, because even like the guy who does food service is like, I like you. You have a really good attitude. The attitude is everything. Attitude is a lot of how this stuff kind of results in good outcomes. And that's really what I'm trying to do. And it's really important to do. I'm going to do a few more videos today just on the ACTA2 thing, because I've realized I have tissue paper level vasculature, and there's some warnings that I need to give you guys. But this is it for now. Be positive, because that's what you want to do, and hopefully good things happen. Thanks.